So now I want to give a definition to some terminologies that are used to describe some abnormalities in the stomach. So you can hear them talking about atresia, you can hear them talking about fistula, you can hear them talking about duplications. So if they talk about all these conditions in the gastrointestinal system, what do they actually mean by that? So atresia just simply means something is narrowing. So it's failure of lumen formation, it's complete or absence closure of any GI lumen. So you have different atresias occurring at different places. You have the esophageal one, you have the duodenal one, this is a duodenal one, you have the anal atresia. So clinical features is the narrowing will cause some one or two blockage, do you understand? So the food is not passing all down, so the baby is vomiting, and the vomit is usually greenish. Okay. Then what again? Fistula. Fistula simply means abnormal connection between what? Two structures. So you can have the tracheoesophageal fistula where there's abnormal connection between trachea and esophagus. Enterovesical, enterocutaneous, that's intestines and the skin. Recto-vaginal, where there's abnormal connection between what? The vagina and the rectum. So feces is moving from the rectum into the vagina. None of that. Okay. Then we have duplications. It's a congenital malformation where a portion of the GI tract is actually duplicated. So small intestine could be duplicated, right? Then esophagus could be duplicated, mouth could be, stomach could be duplicated, colon. So clinical features is the abdomen is so big because there are so many things in it, you know, obstruction symptoms, GI bleedings, and diagnosis you all those ultrasound. Okay, so surgeries you do there is basically to cut out the second abnormal part.